Malnutrition is a major problem, with Namibia suffering the triple burden of malnutrition. This significantly impacts national development as well as communities and families in rural and urban areas across the country.
Malnutrition is having two causes mainly. You are having these direct causes. A direct cause is where the child intake of the vitamins and minerals is not sufficient. And then they develop either a kwashiorkor or embarrassment or whatever. Even obese. If you are too fat, it's also a malnutrition. And then we realize also that number two causes are the one now in a community. Because you will get things like poverty, unemployment, alcohol abuse, those social problems in a community. Teenage pregnancy. You find out also mothers who are not using contraceptives.
Omaheke is among the regions where malnutrition rates are extremely high, with members of the San community being the most affected. Them and other communities in urban and rural areas face a variety of challenges, such as access to nutritious food due to poverty and inequality, as well as a lack of awareness and knowledge on gardening, healthy diets, breastfeeding, and child feeding practices. While addictions to alcohol, gender-based violence, harmful cultural beliefs, and poor access to water, family planning, and social protection services are all contributing factors.
We have tried having a garden, but we have a problem with access to water. From the nutrition awareness, we were informed to incorporate potatoes and cabbage into our diets. That is an additional cost, which is a challenge. I had a garden, but I was faced with the problem of water access. The sun is also a problem as the heat kills the plants. We mostly eat porridge, and when we have access to soup or sauces, we incorporate those as well, as no one wants to eat bland porridge.
In this region, specifically in Omaheke, where we are, it's one of the regions that is well stricken in terms of malnutrition. And this has to do with the type of people that are in the region as well. We have most of our patient SHGB program are the marginalized group, which is the San community. And we know psychologically, socially, and economically, these are people that are not well off. They are deprived in so many areas, and as such, it affects their quality of life, whether it's health-wise or social-wise. And they are more prone to malnutrition because they are not having access to a lot of facilities. When you look at statistics, mostly people that are malnourished are from that same community.
What we also do, we move out to different schools, whereby we also give sensitization talks to girls. I had sensitization talks with teenage mothers that are attending school. Some of these mothers even have 2 children. So I do a lot of motivational talks also with girls to try and prevent already unwanted pregnancies or families that are in very difficult socioeconomic circumstances. You find, for example, in one household, 3 generations, and where there is no source of income, no one having a stable employment, but yet there's 3 generations are staying in that one house. There's no prospects for the future. There is no planning. They just have no hope, no aspiration as to what they are going to do with their lives. And there's this vicious cycle of poverty whereby the one generation after the other is just falling in the same trend of thinking, the same trend of behavior.
2023, the highest deaths that were recorded amongst children were caused by malnutrition.
These shocking numbers reflect a very sad reality across Namibia, and interventions by caring community members in form of soup kitchens are a much-needed lifeline for many children.
Speaking now, we are having plus minus 30 soup kitchens in the region.
I work with vulnerable children, including street kids, those discharged from the hospital who are brought here.
Gebring word When I started, I made fat cakes in Kapana. I would stand at the community tap, and when the children came with their mothers or fathers to fetch water, I gave them food. Then I invited them inside so I could make porridge, and that's how it all began. Some of the children live with me, those who don't have parents.
Most often, parents don't bring their children on time to be fed, and the children stay home hungry. Especially on month end, they don't bring the children and take the children with them to places where they're drinking alcohol. As a result, the children don't eat on those days. Another issue is that we cannot observe the children because we don't have transport to go and observe the children at their homes, seeing the conditions at home. To date, we don't know under what conditions the children are living at home.
Such initiatives like soup kitchens and early childhood support are crucial and need to be combined with nutrition education for educators and parents. At the same time, organic gardens need to be integrated at such centers and households, and communities must be supported in establishing their own small gardens at home. Hereby considering affordable access to clean water and sanitation. Lastly, more efficient social protection mechanisms in form of a universal basic income grant are crucial for people's livelihoods and to boost local economies. Ideally combined with physio-social support to tackle severe challenges such as alcohol and drug addictions, teenage pregnancies, and other physical and mental health related challenges.
Malnutrition is currently today an emergency in the Omaheke region, but it seems to me that we are not doing enough. I don't know where we are missing the point because a lot of children are still dying, and that is, I think, to me, it's attributed to lack of coordination mechanisms between government and civil society organizations.
There were a lot of malnutrition cases in a pediatric ward, a lot of deaths. So what they did is that they call governor, our Honorable Governor Piyon Kanate, as well as the chairperson of the regional council. So they went to the hospital. So and then they called me because by then I was working with the regional council as an HIV and AIDS regional coordinator. So my thinking just at that point was that here we need a multi-sectoral approach because the Ministry of Health alone cannot do this. And I was telling them that no, we need to establish a multi-sectoral task force where we have to see how all the sectors, all the NGOs, civil society can assist us to reduce the cases.
NAFSAN, with support from the European Union, has been working together with its member organizations, government, and international development partners to identify and understand causes of malnutrition and how these can be addressed. Several visits to the Omaheke region over the last 3 years have provided invaluable insights regarding the realities on the ground. It has become clear that the high number of malnutrition cases and deaths recorded at clinics and hospitals are just the tip of the iceberg. They are also a warning sign for much larger issues within communities fueled by huge inequalities in society. Malnutrition is often an intergenerational problem, and while there are several institutions, projects, and initiatives, too many of them operate in isolation. Since 2022, NAFSAN started bringing together different actors for improving interventions, finding synergies, and fostering collaboration.
NAFSAN is an umbrella body for civil society, academia, and currently also the private sector. We are a technical partner to government with regards to food and nutrition security. So our role basically is to develop and provide information, to coordinate on national but also on regional level, and to also advocate for positive behavior change and changes in policies.
NAFSAN has done a lot in terms of advocacy around malnutrition and around coordination. But it seems to me that all the good work that NAFSAN has done is falling on deaf ears. Because I still see some loopholes and gaps within the coordination mechanism.
NAFSAN does not intend to have any regional offices, but we want to identify CSOs or civil society organizations that work in a particular region on those nutrition and food security specific topics. So this program through the EU, this project has enabled us to really pilot this type of hub CSO model. And we have been working within those 3 regions with 6 different NGOs.
Cohena is an NGO that focuses on community-based TB care. And the vision of our program is basically to have a society where people are empowered to be able to manage their own health, as well as the quality of life of their own family members and neighbors. So in relation to malnutrition, so we cannot talk about quality of life when people are not well nourished.
Light for the Children Foundation has been appointed the role of serving as a hub for the purpose of ensuring effective collaboration between the various stakeholders, and with the final goal, obviously, of addressing malnutrition at its root, making sure that the severe malnourished children receive the necessary services that they need to.
I also appreciate what NAFSAN is doing is the nutrition for health training that we have been providing to ECD centers, the people that are actually really working with these children, and also the trainees that we are using to go out into the fields and provide training to the communities, the rural communities, getting that beautiful information out to people that cannot, at the end of the day, access information in Kobabes or wherever, or television or radio. That was really something exceptional.
Solving complex and intergenerational malnutrition issues requires innovative ideas and multi-sectoral, multi-stakeholder coordination at local, regional, and national levels. This is what NAFSAN is strongly promoting and advocating for. More on this in the next video.